Good morning, good evening, good afternoon, everybody. Thank you for joining this webinar aimed to introduce to civil society organization the International Standard on Drug Use Prevention, which were jointly published by UNODC and the WHO. I will start with some housekeeping and remind you that the webinar is being recorded. This session is also interpreted in French and Russian, so a participant can choose to listen to it either in English, which is the original language, or French or Russian by using the drop-down menu at the bottom of the screen titled Interpretation. It's important to mute the audio channel named Original to avoid hearing also the English version and the interpretation at the same time. So if you want to listen to the French version, just go to French and mute the original language. You can see also more the instruction in the chat box. After the session, we will have a possibility to make question and answer, but you can put already your question on the question and answer and not in the chat box to avoid the chat to be very busy. So I'm really, so first of all, for those who don't know me, I'm Mirella Dummar-Frahi. I have the privilege to head the Civil Society Unit in UNODC. And under the direct supervision of the Director of the Division of Policy Analysis and Public Affairs. Just to give you an idea about the geography of UNODC, this is one division, and later you will hear Giovanna Campello, who is the Chief of the Prevention, Treatment and Rehabilitation section, which is in another division, the Division of Operation. And this event is organized together with the Vienna NGO Committee on Drugs. I'm very pleased to have Jamie also opening this webinar with me. He will be speaking in a few minutes. And thank you to all who interested. We had really a record of registration, over 400. I can imagine that not everybody will be here, but it's great to know about friends and organization that I am personally missing for not having seen them for a while. People in, I could go through the list, people from Lebanon, from all over the world, and yeah, thinking about you. The Civil Society Unit, for those who don't know us, is the main entry for civil society engagement within UNODC. We facilitate civil society participation in various intergovernmental meetings, including the Commission on Narcotic Drugs. We also provide training and workshops to build the capacity of civil society in view of supporting member states in the implementation of their international commitment on drugs and crime. And also to ensure that the voice of civil society is heard in international fora. Most recently at the ministerial meeting in 2019, member states have reiterated their commitment to strengthen effective, comprehensive, scientific evidence-based demand reduction initiatives. As part of this effort, the International Standard on Drug Use Prevention are an important guideline, which summarize currently available scientific evidence and describe intervention and policies found to improve drug use prevention. This important seminar is part of the series. Some of you were with us 2 weeks ago on another on the drug control convention. There will be another one in 1 week on treatment and harm reduction. And I would like to take the opportunity to thank specifically our donor for this webinar, specifically INL and the US government, but also I take the opportunity to thank our other donor, namely the government of Sweden and the Russian Federation, who has been continuously supporting the work of civil society on the word on drug and the marketplace, the NGO marketplace, which is an important tool that I hope you have the opportunity to use also from time to time. Finally, I would like to conclude with a sentence which sounds a banality. Prevention is better than cure, and it's so true. It is probably a banality, but it's so true in this time of pandemic. So I really look forward to hear Giovanna, but before that, I would like to give the floor to Jamie for some
Hello,
remarks.
good morning.
Oops.
So should I come to your office?
We have an intervention. I think, Mariana, can you?
It should be in Inspira.
Can you mute yourself, please, Mariana?
Okay, thank you so much. Bye.
Okay, thanks, Mirella. Thanks for giving me the floor. Yeah, so my name, as I said, as Mirella said, my name's Jamie Bridge. I'm the chair of the Vienna NGO Committee on Drugs. And yeah, it's my pleasure to welcome you all to the webinar today. We've got more than 200 people on this meeting, which is fantastic. So thank you all for joining and from all around the world. But yeah, as you know, particularly thank you to UNODC, especially to Mirella and the Civil Society Unit, but also to the Prevention, Treatment and Rehabilitation section for organising this event alongside VNGOC today. And thanks also, as Mirella said, for the direct support from the US government. The Vienna Committee represents around 300 organisations from all around the world, and many of our members are here today. Our members work on prevention, on treatment, rehabilitation, social reintegration, recovery, harm reduction, palliative care, policy reform, and so much more. The role of the committee is to link NGOs with the UN processes and the UN entities that work on drugs, and to help promote the awareness of the key issues, the key processes, but also the key resources related to drugs, such as the standards that we're going to discuss today. So we're delighted to be supporting this series of webinars. We held one last month to discuss the International Drug Control Conventions, and the video from that is available on our website if you want to watch that. It's vngoc.org. This one today focuses on the international standards on drug use prevention. And as Mirella said, there's a webinar next Wednesday on the 17th of March, which will explore the normative guidance on drug treatment and harm reduction as well. The other thing that the Vienna Committee tries our hardest to do is to provide as many opportunities as we can for NGOs to speak, either at the CND or at events such as this one today. So the VNGOC board are delighted to have selected Dayana and Eric to speak today after they responded to our open call for applications. So whenever there's an opportunity to speak, we do an open call so that any NGO from anywhere around the world can apply to speak at these meetings. The standards on drug use prevention have been around since 2013, and so many of you will be familiar with this important document already. But whether or not you've seen them before, today is a great opportunity to learn more about the standards, to hear about how they've been used on the ground, and most importantly, to ask questions which you may have at the end. So as Mirella mentioned, please do ensure that you've selected your interpretation language, even if that is English, and then mute the original audio so that you can hear the translation. And if you want to use the chat box to introduce yourself, I see lots of you have already done that, which is fantastic. So please do introduce yourself in the chat box, but please use the separate Q&A option if you want to pose a question to our speakers. And as I've said, we'll have time for questions at the end. So without further delay, I'd love to give the floor now to our main speaker, Giovanna Campello. She's the chief of the UNODC's Prevention, Treatment and Rehabilitation section. Giovanna is a long-term ally of civil society and has been driving forward UNODC's work on evidence-based prevention and treatment for more than 20 years now. So I'm really looking forward to her presentation, and Giovanna, the floor is yours. Thank you.
Thank you, Jamie. Thank you, Mirella. Thank you, Vienna NGO Committee and Civil Society team for the invitation. I must say that I am a bit nervous and moved by seeing so many participants from really all over the world. I'm used to this presentation, but it's a very special moment, I have to say. Thank you for giving me the floor. Let me share my screen. I managed before, so hopefully it should not be too traumatic this time as well. And maybe somebody can tell me when the slides are actually online. Can you see the slide?
It's online.
Yes, I can see Eric gave me the thumbs up. Thank you so much. So, dear friends, I'm also trying to use a new kind of a bit more participatory tool. And as Jamie was mentioning, the standards were first published in 2013. We had the first edition. And so we have been, working on the standards for quite some time. And I wanted to, oh my goodness, now this one is not working. Give me 1 second. Okay. I wanted to know from you your level of engagement of the standards. So if you take out your phone and you go to slido.com and you enter the number that you see there, which is hashtag T092, you should be able to give me your sense of how much you have been in contact with the standards. And unfortunately, I could do this only in English. So I will read things for the benefit of people listening to this in translation. Oh my goodness, now everything is moving. Your first option is, this is the first time I hear about the standards. Then there is second, I have heard about the standards. Third is, I have listened to a presentation on the standards before. Nobody's choosing that one. That is incredible. I thought that actually people would be mostly there. 4 is I have actually opened the standards and I've read a couple of pages. 5, I have read and used a particular section of the standards. 6, I have read the standards in good depth. And 7, I know the standards by heart and I can give you a demonstration, in which case I give you the floor and I let you take over. But I can see that you are already active and things are coming in, except that now I need to move this window somewhere so that I can actually see your answers. Let me minimize this. And so we have so far a good almost 30% that is the first time to hear about the standards. Welcome, I'm very happy. Some people have heard. But there is also a few people, quite a good amount of people, 70%, 15% that have already read and actually used the standards. Nobody is choosing, I know the standards by heart and I can give you a demonstration. Come on, don't be shy. But okay, so it's good. We have a good spread, and I hope also for the people that maybe have listened to a presentation before and have used the standards, there will be some, some good ideas that, some new ideas that I share, or if not, it's still an opportunity to ask questions, as Jamie was very rightly pointing out. I will move out of this poll now. There will be others on the way, so please, stay with me. But first, let me tell you a tiny bit on why and how we developed the standards. This is a true story. I don't know if Jamie or Mirella were there. This was a meeting of one of our governing body, and I had a delegate that said, the delegate Rose raised their hand and said, nice picture about prevention. You say prevention work, but prevention doesn't work, does it? And I had been, studying prevention for the last 15 years, and I thought, like, well, no, I mean, we have science that shows that prevention is effective, but it is at that point that I really thought I have to make an effort to summarize the science, to make it at the disposal of everybody. And this is why we started to do the standards, because that's what the standards are. It's a summary of the science about what works and what does not work in prevention. Our first edition was in 2013. Our second edition, which is the one I will be talking about today, was published in 2018. And this time we were together with WHO. But as all the time, we were not alone. We had more than 100 experts, including people from civil society from more than 40 countries, helping us along the way. And just to give you an idea of the kind of studies that are at the basis of the standards. So this study looks at a prevention program. I will tell you more about it later. And this prevention program was delivered when the youth was fairly young, but they followed the youth until they were 21. And you can see in the blue, it is represented the people that did the program, and in the red, the people that did not the program. And you can see that following children and youth until they are older can show that good prevention results in less use, so less use of marijuana in the past month, but also less teenage pregnancy and more enrollment in college. So really, when I say that an intervention has been found to be effective according to the standards, it is because behind this sentence, I have this kind of studies that have followed children and youth and adults along a period of time and have seen that as a result of that intervention, less people have started to use, more people have good health and well-being. Okay. But so what did we find out? What is there in the standards? And this is the table summarizing the standards. You can find it also online on its own without opening the standards. And you can see here, let me see if this one works. No, it doesn't. You can see here on the horizontal thing on top that we have interventions for all ages and then interventions in many different settings. But what this table tells you is that there are a lot of strategies that have been found to be effective in preventing drug use and in other risky behaviors. And I would like to stress this because if you do prevention well, if you follow the science, you will see less substance use, of course, but also less mental health problems, less violent behavior and delinquency, better school performance, and less risky sexual behaviors, for example. So really, we are talking about supporting the healthy and safe development of children and the well-being of youth and adults. This is what evidence-based prevention is about. And because of this, we have the evidence that evidence-based prevention is cost-effective. Mirella was saying prevention is better than cure. Well, I mean, I don't want to go there, also because there is a lot of very good evidence on the effectiveness of treatment and healthcare and social protection for people who use drugs and people with drug use disorders. But it's certainly true that prevention is effective and is cost effective. And this is a very old, very conservative calculation of how much you can save in future costs of health and social services if you invest in prevention, 1 to 10. So how does evidence-based prevention look like according to the standards? And here, I think I have, if I remember correctly, I have another little poll. Let me see. Yes. If you go to slido.com, oh, there is another, the number is the same. So maybe now you can see this other question, which is at what age can prevention of drug use and other risky behaviors start? And okay, somebody was very, very fast. Come on, let's have it. And I've given you the ranges of age. Don't be shy, there is no right or wrong answer. I'll give you some answer afterwards, but and nobody can see what you are voting. Come on. Nobody on the 15th to 19th range? Interesting. I'm waiting for a tiny bit. I'm trying to not to distract you from voting. Okay, maybe I will start. I have a lot of people before birth that replies before birth during pregnancy, which is really remarkable. Of course, I've also realized that, of course, many of you are familiar with the standards, and I've given you the answer a little bit in the previous slide. And many people have chosen 6 to 10 years of age, 11 to 14, 0 to 5, all very good answer. Very few people have replied 15 to 19 or 20 to 25. And if you had, I salute you, because in reality, when I go around the country, those are the ages where I see a lot of prevention: 15 to 19, early adulthood, 20, 25. And I see very little prevention before. Even if I will move on now, indeed, oh, I don't know how to move on. Give me 1 second. Yes, indeed, one of the hallmarks of good evidence-based prevention is that it starts very early. Here I write the earlier the better. Okay, I was maybe being a bit dramatic, but as I've shown you before, there are interventions that have been found to be effective when children are very, very young, and in fact, even during pregnancy. So there are things that you can do during pregnancy that will positively have an effect on the health of children and youth, and will result in less risky behaviors, including drug use. And there are things that you can do in early childhood education, so that's kindergarten years, or in primary school, classroom environment, personal and social skills, mental health services. And in fact, this graph that I was showing you before is from a program that you deliver when children are 2 to 5 years of age. It's a program of early childhood education. And as you can see, they follow the children from when they were in kindergarten to when they were 21, and look at the amazing results in terms of supporting the health of these children throughout their development. But so, okay, we talked about age, but when you think about the content of prevention strategies, what is the most important piece of content that comes to your mind? And here I'm not giving you choices. I just want you to write resilience, for example. Thank you, whoever wrote resilience. Please, let's have you as many responses as possible. Environmental strategy, not necessarily in English. I will not necessarily be able to read them, but it's important that we share with each other our ideas. Community, coping mechanisms, skills, emotional intelligence, mental health, very good, keep it coming. Social competence, empowerment, harm reduction, life skills becomes bigger, environmental strategies as well, truth, treatment, power, self-esteem, community becoming bigger, life skills still bigger. Interesting. This is actually a very nice tool. Thank you, Jamie and Mirella and Sarah, for compelling me to use it. Resilience getting bigger. I'm just waiting at a tiny bit. Students Club in School of University, peer education, social support, and so on. Information is coming up. I was waiting for that. So thank you to all that have voted. We can really see a lot of different aspects with a lot of emphasis on life skills, resilience, community, environmental strategies, reducing risk factors, very good, and also information. And it actually took a little while for information to come up. There were many other things coming up, and I don't want to discount everything else that has been provided. There are loads of very, very excellent points. But one of the reasons why I wanted to do this exercise, let me see if I managed to move on. Yes, is the fact that evidence-based prevention tends to focus on the development, and I don't mean social and economic development, although that is also an important part, but really I mean the development of children and youth as they become adults, and to support the healthy and safe development of children and youth, and not only information. Don't get me wrong, of course, information is important, perception of risk is important. This is a very famous graph showing how, as the perceived harm of cannabis in this particular case has been going down or up in the United States, use as being mirroring this trend and going up when the perception of harm is low, and vice versa. So yes, very important factor, but not the only one. And on the right, you can see more the balance of all of the risk and protective factors that are at play and where we can work on to prevent use and other risky behaviors. And I want to give you a particularly important example. One of the interventions that have been found to be effective in preventing drug use and other risky behaviors is parenting skills programs. And typically, when I go to countries and I say, do you work with parents? Many countries say yes. And when I ask them, what do you do? They say, we have seminars for parents, telling them about the risk of drugs so that they can talk about it with their children. And this is all very well and good. It's an information-based kind of intervention, but that has been found not to really work. What works has been found to be programs that help parents to be better parents in very simple ways and really strengthen the bond between parents and children, which is the most important protective factors, provide parents with how to monitor the lives of their children and set discipline in a positive way, in a way that strengthens the resilience of the children and does not diminish the bond between parents and children. And I would gladly give you some more example, but I'm also a bit cognizant of time. So let me go on and just to underline that this kind of programs have been found to be effective, not only in any community, fine, with not any particular problems, but also in very violent communities. This is a effectiveness from our program in various countries, including Honduras. in very poor communities as well. Again, an example from all around the world, including Iran, where communities were very poor. We have worked with displaced populations, refugees, and we have found very strong benefits for the children. We have seen that preventions with families is the kind of prevention that is more consistently effective for both girls and boys. Again, this is an example for both showing effectiveness for both girls and boys. And we know from the work of WHO, the family-based prevention is also effective in preventing violence, particularly youth violence, and child maltreatment. And so that is why family-based prevention that really helps with the development of children and youth has become a cornerstone of our prevention program. We have created new programs that are at the disposal for everybody, also for families in very difficult situations. And during COVID, these are the one for a difficult situation. And during COVID, we have created new resources for parents that had to deal with the stresses of the pandemic, and to do that in a way without resorting to negative coping mechanisms, including use or violence in the family. And so I'm a bit cognizant of the time. Can I have a reality check from my friends? How much time do I have still? Maybe 3 minutes, I think.
Yes, so 3 to 5 minutes, Giovanna.
Okay, I'll need to cut a little bit on this one, on a couple of points that are coming up. So evidence-based prevention, as I said, can start very early, but it's never too late. And I just want to say that there are many interventions and policies also for adolescents, older adolescents, and adults, including young adults. And these include some of the interventions that you had already identified in the cloud: preventive education, school policies, a lot of environmental policies on alcohol and tobacco in the workplace, in entertainment venues, and of course, screening and brief interventions in various settings. The other point that I wanted to highlight is the need to use evidence-based programs. And I had a little poll here again, but I will skip it in the interest of time.
Giovanna,
no,
you have more actually. We calculated better, and you can have 6 more minutes. So if you wish, go ahead.
Okay, dear, you had said something very dangerous. You realize that, right? Giving me this this free time. So let me then, please, everybody, quick, go to Slido and type, what does evidence-based means for you? If I said, oh, you should really do evidence-based prevention, and you say, yes, I'm doing evidence-based prevention, what does it mean? What are you doing? What does evidence-based prevention means for you? And this is really free, so I'm waiting for things. Proven results, for example. Somebody, thank you for being the first one. Research, proven results, prevention based on scientific facts, very good. Proven beyond doubt, even. Can you see? Okay. Thank you all. I think that you can see some themes coming up there, and I will move a little bit. I like this thing too, even with the cloud, we could see everything together, right? So maybe that one was a bit better. But yes, for us, when I say evidence-based, is a strategies, the effectiveness of which has been demonstrated through scientific research. And what I mean is not personal opinion, happiness, feel-good factor, tradition, moral value, visibility, which are all Also, very important consideration, don't get me wrong, but really we want strategies that have been already proven somewhere, maybe somewhere else, to have positive results. And if you don't have that, we'll get to that. What happens, and that these are the things that maybe we can discuss a little bit more during the question and answer, is that many people say, oh, really? But these programs have been created elsewhere. And what I can reassure you is that if you follow a systematic process of local adaptation, and I could give another entire presentation on what this is all about, you can get good results. It's like when you buy a dress, you first try it, right? You don't change it first. First, you try it as it is, you see if it works, and if it doesn't work, then you either change dress or you change the dress. But so it's possible, and it's important to follow a systematic process of local adaptation. We have done, for example, this a lot with families, but also in schools. Here you can see two of the evidence-based programs that we have been using around the world. Unplugged, it's a European product. Lion's Quest is an American product. But following a systematic process of local adaptation, we have been able to show actual effectiveness. And this is a graph that comes from our work in Montenegro, for example. There will be time where you cannot access an evidence-based program. Maybe for what you want to do, there is no evidence-based program. And there are gaps in the standards, don't get me wrong. In that case, of course, you will need to develop something new, and of course, you will need to evaluate it. But also what you could do is to use the standards to at least improve. So if you look in the standards for each of the strategies that are in the standards, we also give you what works and what does not work for that strategy. So for example, in preventive education for adolescents, we know that certain content works. Like here is written, I would go, I'd skip the actual content, but to give you an example, we know that certain delivery methods work well, and we know that certain things do not work in prevention education. So what you can do, if you're doing prevention education for adolescents, you can take the standards, open them, find that intervention, and go through the characteristics and see, compare what you are doing with what science tells us is working, and see whether and how you can improve. So that's these are all ideas on how to move from having, you know, a prevention that is not evidence-based to have better prevention that is effective. And you can use the standards to do this with any of the strategies that have been identified as being effective in the standards. Finally, one of the things that we need to keep in mind is that more and more, and this is where I think the next presentations will come in very handy as good examples, is that there are many risk and protective factors that need to be addressed, okay, in many settings. This also means that as far as you can, evidence-based prevention should be covering different settings in an organized way. And I give you just this one example of a program that was preventing the non-medical use of prescription opioids in the United States. And you can see they started in 6th grade, which is when the kids are about 12, and they followed them until they were 18. And the control group in gray is the kids that did not do the program. So you can see that the prevalence went up. You can see in the green that with the evidence-based school program, when the kids were 12 only, already the prevalence goes up 5% less. which is great. But if you add a family-based program, the prevalence goes up even slower. So really you are preventing at least 10% of use over the course of 6 years, which is great. And more we should try and move from doing one small program to build together a system of prevention that covers different ages and different settings. And I think that this will, you see, these are the settings. this was what I was looking for before in reality. But this will, and with this I conclude, because I think I've given you at least some ideas on how to use the standards to improve prevention. And I hope I have inspired a little bit to see that there are programs that are really concretely effective in preventing use, but preventing all other risky behaviors. And that to pick up those standards and to write to me, and so that, or to write to each other and network with each other, learn from each other, to make sure that we do the best evidence-based prevention possible, and really ensure that children and youth grow healthy and safe into adults enjoying really great well-being. So thank you so much. Please do get in contact, and I will be ready to answer your questions later on. Thank you. And sorry if I went too overboard. These are my contacts.
Thank you very much, Giovanna. And yes, I'm sure many knows your contact, but many are noting them down now. And there are already a number of questions that we will answer after the coming presentation. Now we have Dayana Vincent from the Fourth Wave Foundation, an Indian NGO, but Dayana has studied in Sweden, I think. I can see it from her CVs, which is obviously a very good school. And she has a master's degree and is a social scientist working on child right use, and she has created SAFE, which is substance abuse-free environment in school and community. And through the project VENDA in Kerala, she empowers children and young adults. Dayana, the floor is yours. Thank you.
Thank you, Mirella. Am I audible, Jamie? Thanks. I will use the next 10 minutes, and at the beginning, I will show you 2-3 slides about the kind of work I do, and then get on to the topic of the discussion for today, and why prevention plays an important role in that. So I'll use the screen share just to give you an idea of can y'all see the screen? Yeah.
Yes.
This is basically Project VENDA. VENDA works out of a state in India called Kerala, down south in Kerala. And we have a high prevalence rate of substance abuse and narcotic use among our teenagers, fairly high, with 10 to 12% is what we have as grassroots information. And we work in various programs. We use prevention as our tool to keep kids away from this use of narcotics, which is one of our rising problems, social problems in Kerala. And we have created something very specific called the SAFE program, which is the Substance Abuse Free Environment School program, where we work with schools across Kerala. Over 6,000 odd schools, we are aspiring to make them substance abuse free. We also have counseling and care programs that we conduct for children to go the full cycle and then integrate them back into the schooling process. We work on alternative pursuits, which is our biggest prevention strategy in keeping kids away. And football is like a crazy game we have here where children really engage. And now we have over 10, 12 football girls teams, which we never had in Kerala. So all of this is achievement enough to show that children really, when shown the right engagement processes, keep away from actually getting into habits that are harmful and unhealthy. We also have community intervention programs where we bring the community together to actually work on specific issues in safeguarding schools. And it's shown us great results because parents then become champions for this program. We have clear vocational training programs because children between 16 and 18 are pretty directionless because they're deep in the problem and the opportunities are sparse. So we have a clear vocational training program that leads them into actually creating something that's long-term and viable as a career for life. We also do a lot of advocacy and networking programs to engage the state government and the central government and the country to create policies that work towards creating safe schools. While we do all of this, the reality of the last year was COVID. And this is the reality on the ground, the small state in Kerala. I can imagine that the similar numbers will pop up across the globe. And the next 8 minutes of my conversation will be just around this and why a prevention approach would be important. What you're seeing on the screen here is that we had a prevalence rate of 10 to 12% pre-COVID. And in just the 10 to 12 months of the COVID year, the number has actually gone up to 24%. And 24% is fairly high and a steep increase. And we're talking about age groups between 12 and 18 or 20 years old. And this is a serious concern because what I'm going to talk about is children going online because their education demands them to go online. And online is where they're actually accessing the drug, accessing the narcotic, and accessing payment gateways to make these drugs available. So with this little introduction, I'll really get on to what I wanted to share here. And I'm hoping that what I will say will resonate with everybody listening to me today. I'll be discussing about the unexpected crisis that this pandemic has created, and that has derailed the entire learning process, exposing children to misinformation, targeted marketing, increased access to drugs and narcotics, leading them to transactional crime. This is a reality here. I will also highlight the need to mount an urgent, dynamic, and international prevention-backed response to deal effectively with these problems. The safety of children is paramount, and we need to do something on the prevention lines because we know as civil societies who've been working in the area of prevention that this process actually has given us great results. Like Giovanna, the previous presentation showed us, prevention process really has its great results working with this age group. And we as a community really need to plan to do something about it. Children's lives with the sudden access to digital content and the opportunity for online communication has opened up this wide world of access to substance abuse and addiction. We all know that, and this is a reality. The increased use of cyber safe space by children for education has made them vulnerable to abuse, trafficking, trade, and misinformation that's available there. As the speed of the pandemic increased, classrooms also moved online, and this has happened across the world. And the downside of this is that our children are affected and our societies are also affected in a large scale. As a result of this, children-related problems, especially in the Asia-Pacific region, has increased manyfold, reversing all the concentrated efforts we had made in the last decade on these issues. This is something that we are really going to grapple with in the coming decade because it's really reversed what we had been working towards. And it's going to take us a lot of time to get back to at least where we are. In a country like India, where access to technology and internet connectivity has enabled the migration of classrooms to the education platform with great ease, children as young as 11 years are now on social networking platforms. And this has seen an increasing trend. And what we know is unknowingly, children partake in social media challenges, which lead them to unforeseen complications. Parents who do not expect to have their children or wanted to keep children away from social media are now expected to put their children online. And this has actually pushed them into a digital deep. Just for the background of the internet use in India, I don't know if a lot of people know about it, but internet sort of penetrated into our country very fast. Like I suppose in many places, majority of the population here seriously are not educated on how to use the internet. We were actually not even taught about important things of protocols and the internet digital safety. Even today, children use the internet without understanding the underlying dangers that are really, sort of designed to target them. Issues being reported every day by children include cyberbullying, impersonation, drug peddling, which is high increase here, and child pornography. Schools now sort of face the reality that there are no more campuses and there's no way to keep these children under their watch. What we know is that parents, children, and teachers are in need to protect these children from misinformation, especially that's related to substance abuse, because this is so rampant here. We really do not know or lack the know-how and the preparedness to manage this, and also the complexities that come alongside with what children face online today. The absence of treatment facilities is another huge problem. We don't have child drug courts, child treatment protocols and services. All of this make it important that we design prevention guidelines for schools at the earliest. It is an increasing concern for parents with children engaged in distance learning that their young are in multiple unsanctioned hangout groups chatting and gaming with their friends. Among the many topics of discussion are messages along the lines of an unending stream of misinformation on substance abuse, leading children to take up challenges and dares online. I'm sure all of us who work with children can resonate to these issues that I'm actually putting up here. This precipitous push into the social media space for school children may seem relatively minor against what we have as a pandemic today, but for parents around the world, including me, I think we've always tried to keep our children away from social media and devices, but now it's become a major cause for concern. At Fourth Way Foundation, that's Project Venda that I showed you earlier, we've been working on prevention approaches effectively, and we've sort of managed to contain the problem of substance abuse in the age groups of the teens and young adults. But that data that I showed you earlier, that it has increased by, from the 10 to 12% to 24% is something that we are not really prepared for. We really were not prepared for that. And the reality is that these payment gateways for illegal substances, its delivery, all of this has moved online into gaming sites and social media platforms. And these payment gateways are not very familiar for the parents or the school enforcements or the law enforcement agencies, which makes it very difficult for us to track and take care of our children. At Venda, we intend to sort of bring this as a very important issue to the Office of the UNODC and the worldwide community, that there needs to be a clear prevention approach focusing two important areas. One is the school. I think we've got to prepare content on preventive protective measures addressing internet as a gateway for drug use, trade, distribution, and sale, leading children to transactional crime. I understand there is with what was presented right now, but I think the next few years we'll have to work around preparing pure content to contextualize it for countries like ours, to sort of let children know that transactional crime is easy, just a few clicks away. And what we also want to bring to your attention is that there needs to be a lot of emphasis on the need to conduct digital literacy classes and the reality or the danger that's targeted or misinformation that's targeted to lure children into addiction and substance abuse. We also want to say that schools need to enforce policies on substance use, sort of to enhance the involvement of all stakeholders to keep their children safe in schools. The other side are the parents. Parents literally in this situation are so caught up with keeping the family safe and keeping their jobs going. A lot of their attention which they had for children or they thought the schools would handle is sort of taken away right now. And I suppose we'll have to work with parents towards regulating the time that children spend online, learning or playing games or using apps, which they deem fit to enable a healthy use of internet, which is important right now, but they need to be regulated, and parents need to be taught that. Parents also need to be taught that their children seem to stay undetected because of the lack of digital literacy of the parents. Because parents are not digitally literate. Children know so much today about the internet that we're not able to track what they're doing online, especially when it's illegal. It's trade of narcotics, peddling of these substances on gaming sites. All of this is a big concern. Part of the exploration also leads kids into the dark web or the net, and this reality has to be immediately addressed. Enforcement alone cannot manage this. I think as parents, we need to start having these discussions at home, at dinner tables, so that children know that there is a world which is sort of targeted at their lifestyles. We also want to say that socializing for children online or chat groups or game groups is the only way of communication right now in this COVID reality. And parents need to be sensitive about, while sort of teaching them to be responsible, they need to also understand that this is the only mode of keeping the connect with their peers. So while we encourage our children to look behind the scenes of why, how, or where these tech companies are targeting children, we also need to teach them the responsible use of internet. So this is what I really, really wanted to bring to the table today, because parents and schools and various stakeholders need to take the ownership of the problem. Children didn't sort of ask for it, but they're being pushed into this process. So the reality of a state like Kerala in India, we are currently doing everything possible to sort of cater to increasing the need for child treatment and care, because children are affected by the problem and addicted to the illicit use of narcotic drugs and psychotropic substances are increasing. More than 50% of arrests related to narcotics involve teens and young adults today. The need to fast track our child drug courts to manage this increasing trend is become such an important issue. And the current lack of drug rehabilitation centers, we don't have services that are child friendly, and we don't have policies. All of this is becoming our prerogative right now, and we're as a state really working towards managing this. We are.
Thank you, Dayana. You have one more minute just to conclude.
Yes, I just want to say that we think of ourselves as an informed community here in India, but I want to bring this to the this rising issue of narcotics among children and youth to the board here, the people sitting here, that Article 33 is the only one that stands core in the human rights treaties in preventing children from illicit use. And while countries work towards it, I hope the UNODC, the VNGOC, the civil society organizations that have gathered here today will sort of create a safer world for our children, looking at the next 3 or 5 years of the immediate response to this issue. And this is my humble request, and I thank all of you for listening to me today, and I hope we'll be able to do something about it. Thank you so much. Thank you.
Mirella, you appear to be on mute. I'm sorry. Yeah, there you go. Yeah.
Okay, sorry. Sorry about that. I was thanking Dayana because she reminded us through the figures that we could see about how COVID-19 has unfortunately exacerbated the problems. Also organized cybercrime and the fact that parents, even if I remember a doctor saying, the more you stay with your children, the more tell them that you love them. and you are preventing them. But unfortunately nowadays, as Dayana also mentioned, even if you stay in the same room, but we are using different devices, looking at different online, and it is indeed very difficult, and we will have to do so much after the pandemic to go back even at the level where we had left things. But let's remain positive, and let's hope that at least, you know, this pandemic has also helped families to be a bit closer together. So now I'm very pleased to have Eric Siervo from CADCA, USA. Thank you, Eric, for first of all waking up very early to be with us, and I hope this start has allowed you to wake up better. And Eric, for those who don't know him, is the Vice President of the International Program of CADCA, and he oversees and monitors a number of training programs to develop community coalition, also in foreign countries. I myself had the privilege to visit with our previous executive director, the Manhattan, one of the community in Manhattan, and I was at that time impressed about, you know, how areas which were considered so dangerous could become really very friendly and possible to live in. So CADCA gave us an example that working together, the communities, they can really make things happen. Eric, the floor is yours.
Thank you so much, Mirella, and it's a pleasure to be here. And I just wanted to take this opportunity to thank you for hosting this event and giving us the opportunity to speak about how we use and apply the normative guidance in the International Standards of Drug Use Prevention, and specifically as it relates to, I'm having a shoot, and specifically as it relates to our specific discipline or area of expertise. As we all know, especially from the presentation that Giovanna just gave, that prevention is certainly multidisciplinary. So within the prevention standards, under the section of drug prevention interventions and policy, our area of expertise at CADCA is on community-based multi-component initiatives. And during the time that I have with all of you today, we're going to really explore how we implement the normative guidance as outlined within the prevention standards. So I'll be talking about a framework that we use to equip local communities on knowledge and skills to mobilize and organize to create community partnerships, community collaboration, community task force, and at CADCA, you know, the name that we prefer to use is community coalitions. But at the end of the day, as the UNODC has described it within the standards of prevention, really these are all forms or synonyms of saying the same thing, which are community-based multi-component initiatives. In addition, we're also going to examine how communities can determine their own local data to assess their problems, to develop, implement, and evaluate strategic plans, enhance their capacity to focus on prevention interventions and policies towards alcohol, tobacco, and other drugs, towards improving systems and environments for all the people that reside within that specific community context. I just want to also mention briefly, as Mirella mentioned, CADCA. CADCA is an organization that's been doing this since 1992 in terms of helping local communities to strengthen and build their capacity to establish community partnerships or community coalitions for the purpose of creating safe, healthy, and secure communities. At its core, we really are able to apply the normative guidance through two parallel goals, and they're measurable goals. They happen simultaneously, the first of which is increasing collaboration among groups or sectors within the community so that they can develop the necessary social capital needed to address local problems through community mobilization and civic engagement. But at the same time, we want to see that effort get channeled in the direction of reducing substance use rates among youth and over time among adults by addressing the factors within the community context that increase the risk of substance use. So I want you to take those two parallel goals with you as we go through the next few things that we're going to talk about, because it is foundational for everything. So in order to achieve these two overarching goals, community-based multi-component initiatives are a vehicle to achieve those goals. Whether you call it a community coalition, a community partnership, or a community task force, they're all a formal arrangement of agreement of collaboration among groups and sectors, be it neighbors, residents, local organization, public and private institutions, where at the local level, everybody comes together to share knowledge, skills, resources, and rewards of working collectively toward the process of creating a safer and healthier community. Now, as I mentioned, the community-based multi-component initiatives are the vehicle to achieve this, but there are some key pillars to this framework or CADCA's model to equip communities to successfully develop community-based multi-component initiatives. The first of which is really centered around that first main goal of increasing collaboration among groups and sectors. Historically, when we think about prevention, we see a lot of interventions with schools, parents, and law enforcement. And as we can see, we have those sectors here. But if we really want to get to the point of achieving community change and having population level outcomes, it really does take a village. So we need to include our local businesses in this effort, media, youth serving organizations, civic organizations, religious organizations, healthcare professionals, our local government needs to be at the table, as well as youth. And in this case, there's a bit of a paradigm shift with youth. It's not so much about lecturing young people about the dangers of drugs. On the contrary, it's about having them be an equal partner at the table where they can express their views of what's happening in the community and what they can do about changing the situation on the ground. So if they're the ones that we want to protect, we need to hear from them what the risk looks like in their community. And at the end of the day, we have all these sectors at the table where we're going to find all the knowledge, skills, and resources needed to bring about local solutions to local problems. I will say, though, that it's not enough just to bring together all of the various sectors in the community. They also need direction in terms of what they want to accomplish and how they're going to go about accomplishing it. And also, achieving alignment in their efforts with all these different sectors and really getting commitment for everybody to come together toward a shared vision and goal. And for this strategic planning process, we take communities through the strategic prevention framework, which really allows community-based multi-component initiatives to, one, assess prevention needs based on epidemiological data, really surfacing what's happening in the community, why it's happening, which substances have the greatest impact, what's the most vulnerable population. Based on that information, they'll need to develop their prevention capacity to address the issues. They'll need to develop strategic plans and action plans about what they want to accomplish from now to 3 years from now to 5 years from now. And then they'll need to move to implementation of effective community prevention policies, practices, and programs to achieve those outcomes. Over time, they'll need to evaluate their efforts for outcomes to see how effective they are. And as you can see here in the middle is sustainability. So how a community-based multi-component initiative sustains its efforts and its outcomes over time. But the most important piece around the strategic planning process is it really puts a credible process in place for a local community to have direction and guidance in their efforts. Also, I want to mention too that there's a third pillar to this framework, which is really about that traditionally a lot of prevention interventions focus on individual interventions, but in this case too, when you have so many sectors at the table, the real focus here, it should be a blend of both. We want to also have environmental strategies. So we equip communities also with these comprehensive strategies to achieve community change, and the development of these comprehensive strategies are part of a process for coalitions or community multi-based, multi-component initiatives to develop strategic and action plans, determining the actions needed to affect community change. But we also want to make sure that, that these comprehensive strategies get to scale and scope to have population level outcomes. So again, the importance of these comprehensive strategies is kind of best outlined here in the social ecological model by Yuri Bronfenbrenner, which basically tells us that there's multiple levels of influence, from the innermost being individual to microsystems. And this is where a lot of our direct services and programs reside in terms of scale and scope for the impact of those interventions. But we do, again, want to make sure that we get to the macro systems, that we're changing policies, that we're creating changes within our localities or towns or cities and communities, and that we're also having an impact on our organizations, right? So then with comprehensive strategies, this allows for interventions to go to scale and scope, which lead to population level outcomes. I'd also like to mention too that within the prevention standards, you know, it is mentioned that these types of community partnerships and collaborations can occur spontaneously. But there are special programs that do exist to provide technical support to communities on a large scale. And basically our framework here really looks at being able to, a process that starts with CADCA training and developmental technical assistance, which moves to working with partners at the local communities to help facilitate this process to establish coalitions and enhance capacity. And by this, I'm talking about bringing those 12 sectors together to start talking about what's happening in the community and what they can do about it. From there, they move to implementing the essential processes. With that, again, it's that process of the strategic prevention framework for assessment to sustainability in their planning. And I just spoke about comprehensive strategies. We want to see them pursue those comprehensive strategies to achieve community change. And over time, watch those community changes increase throughout the community context to achieve population level outcomes. And I do want to just summarize this piece quickly by saying that, you know, in terms of what community coalitions or partnerships do, is they really look to impact a specific community. And again, just to recap, we want to see within that community context a type of resource assessment where we're mapping out where all of our sectors are, our champions and our resources, and really begin the process of engaging all the sectors within the community context. But we also have to have that strategic planning process where we can surface the conditions within the community setting so that when we get to interventions and comprehensive strategies, that we have plans on how those conditions are going to be reduced over time within the community context, all with the purpose of reducing alcohol, tobacco, and drug use throughout the community. I will just mention, I mentioned earlier that there's a role for civil society organizations here. And in the case that we found that community coalitions that have civil society organizations helping to facilitate this process, notice the word there is being a facilitator or coordinator, really helps accompany the capacity building that needs to happen among community members, ensuring a a transfer of knowledge, skills, and ability through this community empowerment process. So that gray arrow you see across the middle is really that capacity growth over time, in the beginning from when the stakeholders are convened within the area of intervention, to moving towards community organizing around addressing, surfacing the problems, to getting to strategic planning and community mediation. As you can see, by the time you get to evaluation, the coalition members' capacities increase to a point that the role of the facilitator is one that is reduced. At the beginning of the process, the heavy lifting came from the civil society organization facilitating that process. But once you get towards the back end and the communities are empowered, it really becomes a process of their own, and civil society organizations can then focus on areas of replication and expansion to develop additional coalitions. And lastly, I just wanted to mention too that we've been doing this now in all 50 states, US territories, and the United States. And we've worked in 28 countries around the world where we've developed a global network of community coalitions. And at the end of the day, all of these community coalitions are applying the normative guidance within the prevention standards around community-based multi-component initiatives. And I'm a little over time, so I'll stop there and happy to provide any additional information during the question and answer period. Thank you.
Thank you very much, Eric, and thank you for this interesting presentation on the work that CADCA does with communities and adapting it to the various cultural environment that you're working with. Now I give the floor to Jamie, who will moderate the question-answer session. Thank you, Jamie.
Yeah, so we've got some good time now for questions, and thanks to those that have already been submitted. So I'll try and go through those now. And yeah, so I think the first one, Giovanna, I'll direct it at you on behalf of Janina Engstrom, but I'll also look at Dayana and Eric to see if you also want to come in on this. So the question is that there's a lack of best practice evidence-based prevention programs for girls. And that's according to the Women's Organizations Committee on Alcohol and Drug Issues, WOCAD. Janine is saying that they have one, Bellanet International, but girls and boys have different needs when it comes to prevention of substance use. Have you encountered that same lack of evidence in your experience, Giovanna? And do the standards address the variety of prevention approaches when it comes to women and girls specifically?
Thank you, Janine and Jamie, for the question. Yes, I have exactly encountered the same situation as Janina has just described. When we developed the standards, we were keeping an eye on results that were different from boys and girls. We found very little. In 2016, we did a specific research looking at all of the evidence-based programs included in the then existing registries in the USA and in Europe, and only 5% of those programs had data on effectiveness disaggregated between girls and boys. Now, I'm not so worried about the fact that girls use different substances than boys, because most evidence-based prevention is not necessarily specific to a substance. I am worried about that there seems to be an indication that girls and boys start to use for slightly different reasons. There is a lot of overlap, but there are differences as well. And girls seems to be particularly susceptible to linkages to internalizing mental health conditions, dysfunctions in the family or in the peer group. And indeed, there is some indication, which is what I have presented to you from the little evidence that we have found, that family-based kind of programs are more consistently effective for both boys and girls, and that is consistent with what we know in terms of differences in risk and protective factors. But these are only indications, and there is a huge lack of research in this area. So what I've given to you is really preliminary indication for the little research that we have. And for the rest, please, let's join forces and fill this gap that is one of many gaps in research in prevention, but it's a really important one. Thank you.
Thank you, Giovanna. Thank you. And Dayana or Eric, do either of you want to come in on this as well?
Jamie?
Yeah, hi.
Right. I just want to say that at least in the Asia-Pacific context, the complication when it comes to gender and the girl child or working with women is multi-fold or multi-layered. Just to give you an example of a girl child in, minority religion, basically in our spaces, coming from a below poverty line background, the interventions at various socioeconomic backgrounds also vary. And when we work with prevention, factors, all of this has to be sort of contextualized or sort of brought into the mix of the kind of prevention work we do. So as much as we say that the problems are similar, the women or girls are equally affected by the issue of drugs and narcotics and substances, but data really doesn't show those numbers really high. It's more because it's not visible. They don't come out and they don't seek help or support. So that would be our biggest area for area of concern and area for work as well.
Okay, thank you. Eric, did you want to add anything to this, or should we move on to the next question?
Jamie, I would just like to emphasize too that as it relates to this, it's I caution generalization of information and really leading in terms of what's happening locally. Different substances and their use, different impacts around gender, really, surfacing that issue locally will help guide the best types of interventions. So if you have a particular substances that's, addressing teenage girls more than boys, it's important to have that data present. So when you're designing and selecting your interventions, you know exactly the target, right, in terms of where your efforts need to be focalized and emphasized. So I would just, again, reiterate the importance of collecting local actionable data to lead those types of interventions.
Thank you. Yeah, no, that's great. Thank you very much. So I'll move on to the next question, which I have on my list, which is from Lord Mobles. I apologize if I butchered your name. Lord is asking, how effective are prevention programs in this present situation when people are starving, they're losing their jobs due to the pandemic, and people who are involved in illicit drugs tend to be involved in that market as a source of income and to evade hunger. So basically, in this ever-changing and complex context we're in, and Dayana mentioned the impact of COVID, in her work, how effective can prevention programs be in that context? Giovanna, do you want to go first on that one?
Sure. And this is an important question. What I would like to remind everybody is that prevention is not it doesn't have the effectiveness of the magic wand of Harry Potter. And I'm exaggerating, maybe I'm being silly, but on purpose, because I also think that we need to be cognizant of what we are talking about. Prevention cannot solve all of the problems of the world. But I will say this, some prevention will be and has been proven to be extremely relevant in this, precisely in these very difficult situations. And I'm thinking particularly, as I was mentioning, family-based prevention, because what we have seen during the pandemic is families under stress, as the participant was rightly asking, and a lot of this stress being directed into violence within the family. That is something that will have repercussion on the safe and on the well-being of everybody, but including the development of children for many years to come. And anything that we can do to support parents in dealing with these difficult circumstances in a way that protects their children will be of help. And we have worked with this kind of programs in very difficult situations with displaced populations and refugees all around the world, people that were in very stressful situations with little hope. And even in these difficult circumstances, we have seen calmer behavior by the children, calmer behavior by the parents, better functioning in the family. It's a small thing, but it can contribute to the long-term resilience of families and communities. And of course, then it will all be up to all of us to make sure that whatever comes, that during the pandemic and after, communities and families will be supported socioeconomically. That goes without saying, but it's also a bigger, how can I say, a bigger discussion than just prevention.
Okay, thank you, Giovanna. Eric or Dayana, anything to add?
Well, Jamie, I'd love to add to that, because we've, in terms of how this relates to community-based multi-component initiatives, for decades now, we've seen situations where a crisis may occur, whether it's an earthquake or an influx of refugees due to a neighboring country in the state of war. How, when you have all the sectors and groups at the table developing plans and strategies and leveraging resources, how they've been able to make the shift to address a greater issue that's in front of them. However, we've never seen this happen simultaneously around the world. So this has been universal during the pandemic, whether you're in Senegal, the United States, or in countries like Peru. We're seeing community coalitions have to pivot to respond to the pandemic in terms of identifying and filling gaps in vital services, whether it's been food pantries or food drives, to developing responses and putting up signage and getting information out about how to stop the spread of the pandemic, or collecting and distributing PPE. We've seen community partnerships and coalitions around the world, responding in the very same way. However, though, the health disparities have expanded during the pandemic, very much in a syndemic nature. So I would also say that the definition of prevention for community-based multi-component initiatives has spread far beyond just substance use, where they have to address the intersection or the syndemic nature of mental health, suicide, and other challenges as a result of loss of income. Also, though, I would say, though, that there's been silver linings in this. Whereas before you had to have people travel to participate and engage in an event such as this one, they're a lot easier to happen now. We're seeing coalitions around the world really engaging with their national health experts and developing their capacity about what they need to know about the effect of family and children, and having a lot of guest speakers, and really working on building their bench strength and capacity to address the changing conditions on the ground within their localities. But I'd also say it's been opportunities to support not only the enhancing of the capacity of local coalitions or partnerships, but also supporting the different sectors and the gaps that they're having. In many cases, cite Peru as an example, local health centers didn't have money for oxygen tanks to help COVID patients, and they did a lot of activities to raise money to support the different sectors within their coalition. So I will say that we've seen this opportunity to address these syndemic issues through community resilience on a scale that we quite hadn't seen before.
Thank you, Eric. Dayana, anything to add to this one, or we move on? No, okay. So thank you. I'm conscious of time, but we've got some really good questions, so I want to give them some attention. But to do that, I'm going to take a bit of a liberty and merge some together that cover similar topics.
Yeah,
so
I've seen them.
Yeah, we now have questions. I want to come to questions that have been submitted by Esbjørn Hornberg and also by Kjetil Vesteras. So, in essence, do you think that governments pay enough attention to prevention? The feeling from Vivendi International is that less resources are allocated now. And Kjetil was asking, when you talk about comprehensive prevention programs, you need to have the buy-in from governmental agencies and the engagement. So how do you address those agencies to ensure their long-term commitment? So Giovanna, then maybe Eric, and then Dayana.
How much time do I have? How much time do I have? Two different questions. I mean, in terms of the I'll start from the second. What we try to do, and I'm sure that Eric would come in with something similar, is that you need to think about long term, right? And really working together with, but not only governmental agency, also civil society, and bring people to that table at different levels. Very often prevention is not centralized, or there is a nominal centralized office, but all of the action and decisions are more local. And where we have been able to work, it would be a long-term process to bring everybody at the table and work together on the standards and see what the standards say and how they can be used in the country, and then choose that one or two slow best practices that really fit the needs of the country or the local community, and pilot it and show that it works, that is feasible, that people are better, that the data does improve, and really slowly change that culture of prevention. And we work mostly at central level. Eric does a much more systematic but similar process at community levels, and there are many other people that do these kind of things, either at central or local level. We just need to be more together. And in terms of governments, really the honest answer is, I don't know, because one of the real problems in our field is that we don't even have the data that there is in the treatment field as to budget and coverage of prevention interventions. And already the data in the treatment and harm reduction fields are relatively limited, but still we have that picture, right? We know 1 in 8 people who needs services, only 1 in 8 are in treatment. For prevention, we don't even have that. And so forget about even knowing about the trend. What I have seen in all of these years is that there is a lot of political goodwill for prevention, but a lot of less political goodwill in, really getting to work. I'm rolling my sleeve up and really moving from goodwill prevention that feels nice and is visible to that evidence-based prevention that needs more long-term commitment. We have managed in many places, and there are very good examples all around the world. We need to try and expand that, and that is where I see it more difficult, and I'm hoping that by talking to you to re-energize also this field.
Thank you.
I can go on, but I will stop.
No, I really appreciate that. Thank you very much. Eric, and then Dayana, do you want to come in first, given as I skipped you last time, and then Eric. Sorry, over to you, Dayana.
Thank you. To be specific about the investments governments are making in the issue of narcotic drugs and the prevention area, I have at least the knowledge enough for the country that I'm representing, and India is making considerable measures to actually address prevention, because this is kind of reaching very epidemic numbers for us across the country, and Kerala is just one example. While having said that, there is a budget allotted, there are schemes that are being planned. The reality is that there are not enough evidence-based or prevention-backed processes that have sort of taken grassroots momentum, primarily because the government is not being able to execute all that they planned, and we don't have a lot of civil society organizations who are willing to engage, considering that it's a very risky place to play in. So the reality is that there is goodwill, there is allotment of funds, there are schemes and measures in place, but actually we don't have hands and legs on the ground. We don't have feet on the ground, basically. We don't have enough people to attend to the kind of numbers. And for a country like India, we're talking about prevention as the only way forward, because our numbers are immense. Imagine treatment just for children between the ages of 12 to 18. One, we don't have care centers, we don't have care protocols, we don't have child-friendly policies to attend to narcotics and drug issues. The other is the affected, the children who are affected by it. That side of the story is never being discussed. Children who are, who have parents who have the problem of drug abuse and narcotics, where is the care system or the social system to, take care of them while the parent is planning to go into treatment? So there's a lot of dimensions to handle this. While there is goodwill, there is investment, we don't have expertise and a lot of civil societies who want to engage in this area. So this is our reality in the Asia space.
Appreciate that. Thank you very much. Eric, anything to add?
Yeah, sure. Absolutely, Jamie. And it goes back to Giovanna's point. I mean, the important thing that we want to see happen with community-based multi-component initiatives at the local level is really changes in policies that lead to changes in practices, lead to changes within the system in the local context that over time leads to behavior change. That's easier said than done. And one of the things that we found in our efforts doing this work is it can be very effective, but it takes time to do a bottom-up approach where you have the communities mobilizing and organizing, developing those plans and strategies for the purpose of getting it institutionalized within the local agenda and allocating resources and political will to see these municipal plans move forward to enhance prevention and change the conditions on the ground. I will tell you though that there is a wonderful opportunity there once you have community coalitions or community collaboratives within a country that can speak from their own voice on how they're doing this, because then other decision makers from other localities want to see that come in, and you're able to take kind of at the local level not only a bottom-up approach but a top-down approach. So think about it as a kind of all of society approach. Really, it does take the grass tops and the decision makers, but it takes civil society involvement to really move the needle. And I would say that the focus here is really about scaling up. So how do you scale up from that local level to the regional level to the national level? And again, it takes these same types of partnerships, but really institutionalizing prevention policies and practices at the different levels, and ensuring that those decision makers are also taking the necessary steps to, well, allocate resources, quite frankly, to put those plans into practice, into motion.
Thank you, Eric. So, no, really good answers, and thank you very much for taking those questions. I am conscious of time, but there's one more question I do really want to quickly take, because I'm aware that we don't have an African person on our panel today. So we've had a couple of questions coming in about how easily can these prevention standards be adapted and implemented in Africa and in the African context in developing countries in Africa. So probably just quick time, Giovanna, just to respond to that, because I think it's a really important point, and then we'll close the meeting. Yeah, Giovanna.
So the standards are a snapshot of science, and we in the standards you will see it's very transparent where the science comes from. Some of the science comes from Africa, not enough. Having said that, we have had a lot of good experiences in getting at least some of these interventions, particularly interventions in communities like Eric was mentioning, interventions of youth participation, family interventions in schools for early adolescents, and interventions that were maybe evaluated elsewhere but through a good process of local adaptation, successfully implemented in the African continent. So it is possible, and it can be effective. We have seen it, and I would be very happy and am at your disposal to share ideas and possibilities.
Excellent, thank you, Giovanna. And so with apologies to those who have submitted questions that we haven't had time for, but you do have the contact details, particularly for Giovanna in her slides. And on the VNGOC website, we will be uploading the video itself and the slides as well. So you've got full access to all of that. And I do encourage you to follow up. Without wanting to make work for you, Giovanna, I do encourage people to get in touch, and also with Eric and Dayana and with the rest of us as well. So just quickly for me to say thank you so much to our speakers. Thank you, particularly Eric, where it's very early for you, and Dayana, where it's a bit later in the day for you. So thank you for joining us. Yeah, I mean, please join us again. We've got another webinar next week on the 17th to talk about the standards on treatment and harm reduction. And then on the 18th, the Vienna NGO Committee has our informal members meeting, where we're going to talk a bit more about the upcoming Commission on Narcotic Drugs. So you can find all the information on our website, so please join us for those meetings. And for now, I'll just hand back to Mirella to give us some closing remarks. So thank you.
Yes, thank you, Jamie. Not really closing remark. I just want to say that it was very interesting and very good to be again with all this group of people. We had over 300 at some point to really prepare somehow and come back. I mean, for me, who cover all sorts of issues, it's good to come back on issue related to drug. The CND is approaching, and we are kind of preparing. I would like also to take the opportunity to remind everybody about the NGO marketplace. Sarah can send the link later, because it would be a place where you could share this kind of experience during the COVID, and like Dayana showed us, the figure that she showed us are so important, and you may have also maybe experiencing something similar. So I think it's good to keep the information and the record, and the marketplace is really a good place to be there. And if you're not already part of it, please do not hesitate to fill in the form, and we will have you also part of this important tool for the drug NGO community. Well, thank you to all. Thank you to the panelists. I will not repeat, Giovanna. It's great that you could find the time, and that you will find the time also next week. And Eric, Dayana, and also Sarah. I want to also thank my team. Billy is in Kyoto covering issues related to the Congress, and he must be sleeping at this time, but Sarah is here. Sarah wears the two hats. She is the VNGOC officer and also helping the Civil Society Unit. Precious help, and the interpreters. Thank you for being with us. And again, I think that was a good session, and see you probably next week. Bye.
Bye, everyone.
Bye, thanks. Too late.